So here we are. I am going to go through different scenarios for the ankle. You will see that there is many different ways, techniques, ideas, thoughts around taping the foot, taping the ankle. People have different types of ankle injuries. They can roll their ankle this way and then create the injury in the lateral edge of the foot, or moving up into the lower leg, which they call sometimes a high ankle sprain. So there isn't one way to do a foot taping, an ankle taping, or basically any other body part. There isn't a holy grail, so to speak, because if they have been wearing high heels and all of a sudden they have foot pain, or maybe they've, in the chiropractic profession, people will come in and they're like, the swelling came out of nowhere and this bone is hurting me, and obviously we will work and we will maybe adjust the foot, but then we can tape it also. So for bottom of the feet pain, you've got where it's more prominent near the toes. It can be anywhere. So I'm going to show you some things that are basically bonuses outside of taping, because you can kind of tape a foot, an ankle, or a knee pretty easily on your own because of the being able to use two hands. I'm going to probably make it look a little easy because I've been using this tape for 15 plus years. So if you go to tape yourself or tape a friend and you find yourself not doing the best job, or it's folding on itself and it's just a mess, just take it off and do it again. It's just repetition that makes taping easier. So if this is the majority of the problem here, we're basically going to tape similar as if the pain was here, or technically medial aspect of the ankle through here. So we will move maybe to this foot to show you how to tape, the extremely less common ankle sprain through here. And typically, if there is any pain going on in the inside, medial side of the lower leg, ankle, foot, it's typically going to be, I'm going to lift your leg, the Achilles attachment here, and then the medial arch dropping, too low, through here, where these bony structures now are dropping down and creating that discomfort where, either manipulation, go and drop it, or if it's a plantar pain, there's taping for that, so I'll do that in another video. But lots of different types of issues, symptoms, injuries with a foot, ankle, lower leg, Achilles tendon, seen it all. So I'll try to hit as many as I can right now with using this foot and using this foot. So let's just talk about the simple ankle sprain where now we've got a swollen ankle and you're like, oh, I just want to tape my ankle for some relief. So what we do is we're going to do this with the single pieces that you can purchase pre-cut. And then I'm going to show you what it's like if you bought this somewhere, Amazon or something, and you've got the big roll and it's not pre-cut, which with ankles, I definitely prefer this, but can be done either way. So let's show you with the single pre-cut pieces. So what we want to do is we will bring and have the person bring their foot up like this. So bring your toes towards your head and just kind of keep it in that neutral as if she was standing position. Rip, twist tear, do the twist tear. Spread these out a little bit, not too crazy, leaving the ends. We're going to start with this one, just getting it started, attaching here. I'm going to leave that as an anchor. We're going to wrap around the foot. Dead center, you can see that we created, drop this all the way out, this side here, where it's wrapping through here, and then I've come around here, and I'm going to have this touch here. Relax your foot. So I'll take a still shot of this view in just a second. But basically you can see here, I've just wrapped it straight around to the other side. Moving along here, what we're gonna do is come back into that neutral position. Twist, tear, tighten, anchor right here. Let's get that anchored in there really good. Heat it up. Feet are usually a little cold. We're going to do a guided slight pull, not a full pull. You can see, oh, it almost came off. And then just a little bit of a pull. And then we're going to slowly guide, slight pull, guide it here, slight pull, guide it here. Just do little tiny sections at a time. That way you don't find it folding on itself and then you're burning through tape. You can relax your foot and your leg. Good. And now we're just going to, without pulling, attach that. Without pulling, attach this. You can see here it doesn't want to stick. So I'm creating friction. Get the glue to stick, get that adhesive to stick. And that is the basic 2. If you only were going to tape 2 for an ankle sprain, these would be the 2 that I would go to. But let's say that there is still, because, you know, this is really good stability for sprained ankle, even if the majority of the damage is here. What you could do here, you can do this a couple different ways. You could, I'm not going to take this off yet, you could just do this one straight across, like this, right over the bony prominence. Or, I'm going to show you a fancy way, is to cut an opening for this. The only other problem that you want to be very sure of is where the anchor is going to be under the foot, because we want the tape to be on the skin and the anchor point. So sometimes it's really good idea to, before taking the backing off, say, where am I going to put this? And kind of look around a little bit and say, okay, I'm going to attach this end piece here, and I'm going to go around this piece. And she showed me how to open this piece up to go around, so it's going to be there. So I'm going to pinch this here like this. You can see it's not equal. Grab my scissors, do a little 1 inch, which is going to equal about 2 inches, opening here, like this. So we can start below that cut, do the rip and tear basically right at that level, and don't really pull too much off. I like to put this between the fingers like this. I'm trying here. This one's a little trickier. Sometimes it just stays better. So the anchor, bring your toes up. No, there you go. You can relax your leg. So we're going to do that anchor way down here, not just basically off the other tape, on the side, not dead center, on the side edge of where the foot comes around here, the skin and the tissues and everything turn. And then we're going to open this. I'm doing a slight pull towards her head. We're going to attach this one. I'm going to just gently lay this one down. Going around that, you can see that that bony prominence is exposing itself now. And then I'm just going to go 1 inch at a time, slight pull. She still has her foot in flexion. And before I attach that last piece and release this last piece here, I'm going to have her relax her foot. Perfect. So I will do this piece here, heat it up a little, and then I'm just going to release that piece. There's a little tiny piece hanging down through here, right there. You can see this piece hanging, and I'm going to do that here. And I'll take a still photo of that in just a second. This would be extremely comfortable for an ankle sprain. So, that would be 3 pieces. And that did a huge coverage for this. So what I'm going to do is I'm actually going to show you what it's like a little bit different and some different symptoms and scenarios with this other foot, and instead of just ripping this off and then restarting. So let's talk about doing the ankle with one big piece. So what I like to do is I say, okay, I know I'm going to want to wrap up into here. I'm going to want to come around, and then I'm going to want to crisscross and then come up about the same. So with this piece and this piece, that's almost 2 forearms. 1 forearm, 2 forearms. You think it's a lot of tape, but look how much tape we used 3 pieces there. So there's 4, there's 8. I don't know, 12 squares, anywhere between 11, 13, somewhere in there. It doesn't have to be perfect. But what we're gonna do here is she's already got her foot where we want it, right? So in that neutral position, we're gonna find the middle. Find the middle of that. And then we're gonna do the twist chair. We're gonna pull back a little here, pull back a little here. And we're gonna aim for basically dead center of the foot and of the arches, and we're going to wrap. I'm doing an opening, I'm doing a slight stretch, so this is no stretch. There's the stretch I've added. I'm gonna wrap this one, relax your foot a little bit, just a little. And then we're gonna anchor that one there. This one we can let hang, and we can come back to that, and we can kind of guide and place, guide and place, guide and place, guide and place. You don't want to do this too much where you lift it off the skin, you can hear it. You don't want to do it too much because then you're losing adhesive. So I'm actually going to guide this one across. Hard with the cream color. Guided this one across. And then bringing this piece, I'm going to crisscross. Slight pull, guiding, slight pull, guiding, slight pull, guiding, crisscrossing across that to come up on the inside of that leg. So when I've done these ankle taping procedures for patients, this is the favorite one that they like, but they don't buy these at home because you have to buy this on Amazon and it only comes in large rolls. Let your leg roll out this way. Perfect. So I'm just gonna finish this off. If this is too long, you're like, man, this is really going up in the leg. The patient won't particularly mind, but you could always just trim it. And I'm not pulling it. I'm just adhering it. And then roll your leg inside, roll your whole knee and hip. Perfect. So with this one, slight pull, slight guidance, coming up just the directly lateral outside fibula out here on the side of the leg. Again, if it's too long, trim it, but this is pretty cool taping job right there. And very supportive and much more difficult to come off. These single pieces typically start coming off a lot sooner because the attachments are where you're walking. But you'll see the pictures on that. And so you could do another one of these. You could do a pre-cut, attach it here, attach it here. You would bring that foot up in flexion again. Anchor here, slight pull, attach, have the patient relax. Drop that down. Yep, and then you could do that. So that would be one huge piece, and then this piece here. So I'm gonna have you flip over, and then we're gonna talk about doing the plantar and the Achilles tendon. So now what I'm going to do is just show you the plantar. I have left this piece on here and taped it across, which you can do with one long sheet like we did here, or you can just do the pre-cut single sheet wrapping here. This is going to give a little bit of support into that arch. And then we're going to do one piece that's going to anchor here, and stretch up past the heel. And those two in particular are extremely helpful. The other thing I do is I give them homework. And the homework is taking a golf ball or a lacrosse ball, a small, hard ball. Tennis balls and racquetballs do not count. So they will roll the ball all around. It is uncomfortable, but it really does help restore arches because the multiple arches in this foot tend to drop. And then what it also does is it breaks up adhesions and basically gets more mobility in the bony segments and the joints of the foot, and then gets that plantar to relax. And in about 2 weeks, with about 1 minute a day of rolling, I always say do both feet, even if this one isn't bothering you, it's probably got the same problems, they're just more quiet. So do both feet, one golf ball, 60 seconds this foot, 60 seconds the other foot. And if this was, go ahead and drop that. If this was your foot, you know, these were your toes, what you want to do is you want to do all the way into the heel with the golf ball and search. Do a little bit of search with the pressure of that golf ball. You can do it sitting, better standing, even though it's more painful. And that golf ball will really, within a couple weeks, pretty much resolve most plantar fasciitis pains. And it's uncomfortable, but it does work. So I'm going to prop her foot up for the camera. Here's a wedge. See if that wedge helps a tiny bit. Maybe. So we've got this piece that's coming across here and wrapping. It's cream. It's there. This piece is much brighter. We're going to anchor here, bottom of the toes. Give it a little attachment, friction, heat rub, just so it doesn't pop off. So I'm going to finish this one here. If you've accidentally left too much tape through here, if you've left too much tape through here, you can trim this so it doesn't go up into the toes if you feel like you need to. This one here on the back heel, this is just a guidance one. Adhere, guidance, adhere, guidance, adhere. You don't want to get any folds in the tape on the walking surface, but once you come up the back, if you get a tiny piece that is folding on itself, nobody's going to notice. But if you're careful and you take your time, you're not going to get the tape folding on itself. Pretty clean. And again, even in the summer, feet are cold and you don't want them just standing up and it popping off. And I can tell you right now, this one needs friction. I can just tell by the temperature of her foot. So this is really good for a plantar problem. Now let's talk about where people talk about heel pain, but it's really the attachment of the Achilles tendon on the lower heel here. And then what I want you to understand is it's not actually the Achilles tendon. I mean, obviously there's Achilles tears, Achilles sprains, but what's usually happening is the calf muscle or the lower leg musculature is getting excessive use. That's the majority of what I've noticed. And so when this is getting excessive use, it's getting tighter and tighter and tighter, and it's pulling on its attachment. And then the attachment is getting little microscopic, I don't want to say that it's pulling off, but it's just getting over excessively used. And then there's a swelling that happens on the attachment, and there's just ends up being a lot of tenderness to the touch. So what I'm going to show you how to tape this problem, but you need to get somebody, a professional or someone that knows how to work on the calf muscle to find typically the trigger points and the knots and the excessive tightness that is easily palpable to work on and dig this out. And if you know any techniques where you can, you know, find them, pin them, and then put the foot into its flexion and then release, go into a point, push down, do this. Obviously, if there's any cardiovascular issues or anything, or vein issues, you would not do these techniques, but that's what the professionals are for, to know not to touch something. You know, that's why we say don't have your neighbor rub your calf if you have a calf problem, because sometimes you can get some serious issues. But if the pain isn't here and the pain is here, then we know that it's where the Achilles tendon is attaching, because it's not even into the bottom of the foot. It's not even where the walking surface is hitting the floor. So let me show you what, this is probably one of the easiest things to attach. The purple is a residual taping of an ankle sprain, and sometimes ankle sprains come with Achilles tendon tenderness or soreness. So you may find yourself doing all of these. So we'll use a regular size sheet, which is technically about 4 squares. What we want to do is we want to attach it, the base, not under the foot. We don't want to go into the heel. We want to stay outside the heel and go to where the Achilles tendon attaches. So we're going to anchor it just above where we don't want it to end. And then we're going to do a slight point, not a full point. So go into a full point and release it just a hair. Yep, a little bit more. Good. And then we're just going to do the guiding and attaching and guiding and attaching. I've got a slight tension on this, guiding and attaching. We want to go extra slow because you're dealing with multiple contours here. And if you go too fast, you'll end up folding the tape on itself. Fully relax the foot, ankle, calf. Good. I'm just going to release this. You can see here we ended perfectly right there. And then I'm going to be careful to guide this one as it releases. There's no tension being pulled here. There. That is for the Achilles tendon. And the other one that people really like for the Achilles tendon is to, most of the tenderness can be here, but if you can sometimes wrap a piece of tape here, it helps with the swelling. And this is just a lateral, slight pull, let it drop, wrap it right here, and then just release these, and then just slide that way, and then just let that one attach. So this one literally is just going just one U shape around. So we'll take some still shots of all this. This is every ankle, lower leg symptom, the easy ones that really can help somebody get through their injuries.